everyone. In today's section, I will discuss pelvic X-ray for a substrate with capsule. This is one of the most common and initial imaging procedures in trauma cases, especially in elder patients after a fall. When a patient presents in pain, inability to bear weight or deformity around the hip region, a pelvic X-ray is usually the first-line investigation. It helps identify fracture of the femoral neck, acetabulum or pelvic rib, and provide an overall view of the pelvic rim. The standard view of the pelvic X-ray is the anterior-posterior view. The patient lies supine on the X-ray table with both lower limbs internally rotated about 50 to 20 degrees and unless by pain or deformity. The central ray is direct to the midpoint between the anterior superior iliac supine in the upper border of of, the Cubic's proper collimation include the anterior pelvic and proximal femora. On the radiographer, you access bone alignment zone, space, cortical continuity, and the clavicular pattern of the femoral neck. A clear break in the cortical outline usually indicates a fracture. If findings are concealing further imaging like CT or MRI may be recommended. So I am sharing the research paper. On the topic radiographic detection of hip and pelvic fracture in the emergency department, this study focused on how effectively radiograph or X-ray can detect hip and pelvic fracture in patients presenting to the emergency department and compared with the finding with MRI results. The main goal of the research was to evaluate how the reliable pain radiograph is in identifying hip and pelvic fracture, especially when patients come in with pain and trauma but have unclear X-ray findings. The researcher reviewed all MRI scans of the lower extremity of pelvic that were ordered by the emergency department between July 2005 and July 2008. Importantly, these MRIs were done after the patient had already undergone radiography. All these images, both the X-rays and MRIs, were retrospectively reviewed by two musculoskeletal radiologists to ensure accurate compression. Each case is analyzed in the terms of patient age, sex, MRI protocol, and site of fracture. Any other possible component and learn analyze foods and spacing in the diagonal part of the radiograph. The study included 92 patients with 97 examinations. Out of these, 77 were women and 15 were men, with an average age of about 70.8 years, reading from 19 to 94 years, showing clear elderly female. Now I will show the book sector on the topic acetybulum and hip joint. This projection is particularly usually when an This projection is particularly useful when an acetibular or hip socket fracture is suspected. It helps visualize both an anterior and posterior ribs of the acetibulum structure that are often superimposed on the understand anterior posterior pelvic xray. Purpose of the tube. The tubed protection consists of two oblique positions, anterior oblique and posterior oblique. Anterior oblique show the anterior ribs and of the acetibulum, and the posterior oblique demonstrated the posterior rib of the acetibulum. These views are specially available in trauma causes to access acetibular fracture, joint involvement, and the displacement of the fracture fragment. Anterior oblique position of the patient and patient. The patient lies prone on the X-ray table. The trunk is rotated about 45 degrees toward the unaffected side, while the affected side is raised and support on non-occupieds. In this position, the acetibular rib near the table becomes nearly parallel to the facet. A 24 into 30 centimeters facet is placed longitudinal in the bucket tray direction and centering on the X-ray beam. The X-ray beam is centered just distal of the optics direct 12 degrees toward the head. The file should be collimated to include the affected area. This position here shows the anterior view of the acetibular and help detect central or anterior well fracture. Posterior oblique position of the patient and patient. Here the patient lies supine on the table. Side is raised about 45 degrees, again support on non-occupied page, direction and centering of the beam. The central ray is directed to the formal pulse on the right side, angle 12 degrees toward the pit. The cassette is centered at the level of the femoral pulse, and the field is collimated to include the area interest. This projection-based demonstration and the posterior rib of the acetibulum, essential for dissecting posterior colon fracture. Now I will share you a case study video. An 84 years old patient arriving in the emergency department after a fall. The suspicion is hip fracture, but early and precise diagnosis is critical. Not just for treatment, but the preventing complication. In this case study will explore how nation ARC imaging technology supported clinicians is diagnosed hip fracture with lower dose and enhanced clarity. Hip fractures is the leader carry high motility, long recovery times, and often late or loss of mobility and independence. A con- conventional imaging modality, understand X-ray or CT scan, can sometimes miss occulted pictures or expose patients to high radiation dose. Insert Insert data insert. According to Knox, many missed pictures are due to limitation in conventional imaging sensitivity. The challenge is detect pictures early, localize thin pieces, and reduce radiation exposure, especially in the elderly patient to the radiation affected. A next generation imaging system incorporating a novel X-ray sources designed for lower radiation dose while preserving or even improving diagnostic image quality. The system is intended to deliver less than 7% of the radiation dose of a typical CT scan, approaching levels similarly to understood X-ray imaging. Let's walk through the case. The 84-year patient arrived post-all suspend hip fracture. The clinician offices ordination asset action scan of the hip region. The images are equipped with the system at low dose then transmitted to the foot PC system radiologist review the image looking for signs or critical decon- discontinuity, stable tape lines, or non-displacement fracture. Crucial, the low-dose nature enables imaging without subjecting an elderly patient to excessive radiation risks. What were the outcomes? Improved detection. Pictures that might be hard to visualize or understand X-ray become visible. Localization and characterization. The systems help determine the precise picture line, displacement, and implement the adjacent structure. Low radiation dose. The acid dose is significantly lower compared to a city, making it suffer of fall patient. Workflow efficiency because the images are delivered digitally and organized with AI assistant for genesis organized with AI assistant for intervention the turnaround the faster and radiologists can flag urgent finding quickly. Now, Now I will share my lab demonstration video.
Hello everyone, myself Aditya Sultana. Today I explain pelvic x-ray for a suspect hip fracture. Pelvic x-ray essentially to detect fracture guide, treatment and monitoring healing. Proper positioning and technique ensure clear imaging. The patient lies supine with leg side rotated inward. Center the x-ray beam at the femoral head and spike pubic to capture the pelvis and proximal femur. Set the machine according to vertical adjusting TBP and MSA. Always follow radiation safety, use this light and minimize exposure. Check the X-ray for clarity and correct positioning in the identify fracture and document finding. That's a brief overview of a pelvic X-ray in hip fracture. Thank you.
Pelvic X-ray essentially to detect fracture, guide treatment and monitoring healing, proper positioning and technique ensure clear imaging. The patient lies supine with leg slightly rotated inward. Center the X-ray beam at the femoral head or spinous pubic to capture the pelvis and proximal femur. Set the machine according to protocol adjusting KBP and MS. Always follow radiation safety. Use light side and minimize exposure. Set the X-ray for clarity and correct positioning. Identify fracture and document finding. That's brief overview of a big X-ray in the fracture. Thank you for listening my video.